Hello all, I'm Dr. Walter from SNS College of Physiotherapy. So today we are going to see a new model of video regarding a new innovative in the physiotherapy technology. So what we are going to see today, actually here we are having our final year and the first year students, and they are going to represent this video in a new way of manner of explaining the ultrasound modality from the Technomed. Okay, actually Technomed is a worldwide, it's a good company. Many of the physiotherapists are adapting to this Technomed company. Okay, so what is the benefits? What is the benefits of the ultrasound? What are the indications, contraindications, frequency, and all these things our students are going to say. Keep it live.
Hi, I'm Dividashni from Final Year BPT. I'm going to explain about Technomed Scientific Ultrasound. So, Technomed is a reputed medical equipment manufacturer and supplier that produces a wide range of physiotherapy, rehabilitation, and diagnostic devices. Among its popular products, the Scientific Ultrasound Therapy Unit is widely used in physiotherapy and rehabilitation clinics for treating various musculoskeletal and soft tissue disorders. So, the scientific principle behind Technomed ultrasound lies in the conversion of electrical energy into mechanical vibration, which travels through tissue via a coupling media. These vibrations generate microscopic oscillation within the cells, enhancing cellular metabolism, increasing circulation, and accelerating the healing process.
I'm Minachi. I'm going to tell the mechanism of scientific ultrasound. So it produces two effects based on their mode. In continuous mode, it generates heat and increases the blood flow. Can be used in the chronic cases. Whereas in the pulse mode, it produces non-thermal effects, which accelerates the tissue repair, and also it produces the oscillatory motion that creates a micro massage effect to it.
Hi everyone, I'm Sagar. Let's see about the indications of the scientific ultrasound. This treatment is typically used for an adjunct patient, which is not a sole treatment. The therapy is used for the treatment of soft tissue injuries like patellar tendinopathy and the lateral epicondylitis, and muscle sprains for the subacute and the chronic stages, and the chronic joint pain like osteoarthritis, which is a degenerative condition, and the inflammatory conditions. This how do I continue? It promotes bone healing and the tissue healing, and the already seen the modes of the ultrasound, which pulse mode can cure the subacute and the inflammation, and the continuous mode which cure the muscle spasm, stiffness on the joint.
We will see about the contraindications of the ultrasound. The main is malignancy, which means suspected tumor. Then cardiac region வந்து பேஸ்மேக்கர்ஸ்லாம் இருந்துச்சுன்னா அல்ட்ராசவுண்ட் கொடுக்கக்கூடாது. தென் கேரோட்டிக் சைனஸ் in the anterior neck. During pregnancy, we should avoid the low back and the abdomen region. Over the eyes, over the areas with the thrombus or active thromboembolisms. Avoid gravitated uterus. மெட்டல் இம்ப்ளான்ஸ் ஃப்ராக்சர் ஆன இடத்துல மெட்டல் இம்ப்ளான்ஸ் இருந்துச்சுன்னா கொடுக்கக்கூடாது. ஃப்ராக்சர் ஹீலிங் டைமில் வந்து இன்ஃபெக்ஷன்ஸ் எதாவது இருந்துச்சுன்னா கொடுக்கக்கூடாது. ஓவர் த ஏரியாஸ் ஆஃப் impaired circulations or sensory loss where patient cannot report a heat or burning.
Hi everyone, I'm Vidhan Surya, 4th year final BPT. I'm going to discuss about frequency and modes of ultrasound. Therapeutic ultrasound uses high frequency waves such as 1 MHz and 3 MHz. 1 MHz is usually used for deep heating, and 3 MHz is usually used for superficial heating. And it is delivered through the transducer head, and it produces biological effects in soft tissues. And there are two modes in ultrasound, which is pulsed and continuous. Continuous usually produces predominantly thermal effects, which is heating, and pulsed ultrasound predominantly produces non-thermal effects such as mechanical, which induces acoustic streaming or micro massage.
Hi, I'm Varnika. So as a seniors has given the introduction and the specific medicines and ultrasound mechanisms, so I'm here to give the conclusion. So ultrasound physiological mechanisms are well described as thermal and plus non-thermal effects. Here, clinical trial evidence is heterogeneous. In some specific conditions like scar management and some pain conditions, exercise is benefited, but in some certain conditions there is inconsistency. Like there is the exercise and the mechanism with ultrasound is not benefited. So, thus consistency and combining ultrasound with active rehabilitation produce better clinical outcomes. With this, also reference conditions with specific systematic reviews when making claims strong.
So, as we discussed regarding the ultrasound treatment, actually, this ultrasound treatment is very well working good. As we see on to the conclusion, as Varnika told, okay, in some cases, okay, when we are comparing with the indications and the contraindications, in some cases, it will not be working so much good compared with the other equipments, but it gives a specific way of treatment, okay, and ultrasound is most variable device in this physiotherapeutic treatment technology, okay, and in other hands, when the practitioners are doing the MFR treatment, that is a myofascial release at all, with the help of the ultrasound head, that is a transducer head, they are releasing the trigger points. It is also working out in these types of possible ways, okay. So we need to understand the concepts of the ultrasound in a well-immersed manner, okay. Thank you all for this wonderful video. We'll meet in the next video with a new topic. Thank you.